process for rhinoplasty procedure is when first consultation with the patient, when I take a picture of the face and the nose especially, and the second consultation when I can draw the new nose. I prefer to do this kind of method without using any software and computer. I prefer to use my hand to draw the new nose. In this way, I can show to the patient the result she can achieve, and I can show to the patient which kind of nose is most natural for her or him, because we have to respect the proportion of the face, the proportion in vertical way, vertical sense, because the face has to be, the nose has to be 1/3 of the face, 1/3 for the forehead, another third for the nail, the nose, another third for the lower face, and on horizontal sense, because the width of the nose on the base has to be more or less the same than the distance between the eyes. So when I draw the nose, I can show to the patient the best result. You can see the result before. The best way to achieve the natural look result is to study before the operation very well the proportion of the face. The first consultation is the most important, because I have to know exactly which kind of result the patient can achieve, and which kind of nose is perfect on the patient face. I think the best compliment for the surgeon at the end of the operation is when the patient said my nose looks as a nose as I was born. I'm more elegant with this nose. This is the best result. It doesn't exist a nose for every face. The nose has to match with the face of this patient. The surgeon has to put the maximum effort to find the right nose for every patient. The rhinoplasty procedure takes time between 1 hour to 2 hours. It depends which kind of operation I gonna do. If the problem is only on the external portion of the nose, so the operation is only for the aesthetical reason, the operation will take less time. Sometimes the surgeon has to fix also the functional problem. That means that you have to work also on the septum turbinati, and you have to work for improve the breathing. The patient can see the final result after rhinoplasty in average time of 1 year. It depends if the rhinoplastic is the primary rhinoplastic. That means that the nose is never really been touched, or sometimes you have to do the operation on the nose that already had another rhinoplastic or more than one. The rhinoplastic is a very complex operation. Sometimes you have to use a lot of different methods. Graft from the hair, graft from the costal ribs, graft from another part of the body, and in these special cases the recovery time can be longer.